Right. Well, it looks like we have mostly everyone kind of entered into the space. So first, I just want to say thank you to all of you for joining us tonight. My name's Sage Ober, and I serve as the Associate Director for New Student and Transition Programs here at the University of Richmond. I work with departments across campus to organize a variety of different Newsfighter Summer Series webinars, and I am excited to have you here tonight. And so I have two guests with me in this space who I am going to have introduce themselves, and then we can I can go over a couple things, and then we'll get started with the webinar. So I will turn it over to Dr. Lemon to introduce yourself.
Sure. Thank you for having me this evening. My name is Latrina Lennon. I'm the Director and Medical Director of the Student Health Center, and I'm excited to speak with you all this evening about our services. Welcome.
Kesha
And
Trim.
sorry about that. So I am Kesha Trim, and I am Director of Risk Management and Insurance for the university. And I will talk a little bit about our student health insurance plan and the hard waiver process.
Great. So what we're going to do is we have a brief presentation to give you with some helpful information. And then once that is finished, we will be able to answer any questions that you might have. And so you'll notice at the bottom of the screen, you have a Q&A box. And so if you type in questions there, we will wait to the end. But again, we will make sure to answer them again before we leave this webinar. So with that said, I'm going to take a second here and get our presentation up. So just give me 1 second. And let's see here. Oops, let's put that in the correct mode. All right, perfect. So with that said, I'm going to turn it over to Dr. Lemon to kick us off.
Great. Thank you again. So this evening, I'm going to speak a little bit about the Student Health Center, including services we offer and the process for all newly admitted first-year students that involves our department. So again, welcome. So to start off with, what is the Student Health Center? So the Student Health Center includes medical providers such as physicians and nurse practitioners, as well as registered nurses and certified medical assistants that provide services for our full-time degree-seeking eligible students. We offer primary care services to our students. We're able to diagnose and treat many medical conditions that you may see with your home provider, such as your pediatrician or family medicine provider. We also see students for acute illness and injury. So obviously being on a college campus, we see students for strep throat, cough and cold symptoms, rashes, stomach upset, and things such as that. And we also provide a lot of health education for students on different health conditions that they may come across during their college health years. And really part of our goal is to help prepare students once they leave college to be able to take care of themselves and their physical health and wellness. We are an accredited medical center. We are accredited by HHC. We just incurred our third year triennial certification last year, and I'm very proud of that for the health center. So that means that we're in the top 10% of college health centers across the country that actually apply and achieve certification. So we're very excited about that. We do offer other services besides the actual evaluation and management. We do offer what we consider point of care testing. So for instance, if a student comes in with a sore throat and there's concern that they may have strep throat, we can test for them there. If a student has concerns about other illnesses such as influenza or the flu, which we see commonly during the winter and early spring months, we can do testing there as well. And finally, we are able to perform phlebotomy, which is blood draw services for students that are seen in the Student Health Center. And I'll talk a little bit more on the next slide about how that incurs as far as charges. Next slide. So where we're located. So for new students new to the campus, and even for our returning students, we recently, about 3 years ago, relocated to a new building on campus. We're located in the Wellbeing Center on the 2nd floor. So for students, as you get acclimated to campus, if you identify where Organic Crush is, which is on the 1st floor of the Wellbeing Center, we are located on the 2nd floor, and my colleagues in the Counseling Center are on the 3rd floor. This building is also adjacent to the Recreation Center by an interior corridor, so we're very easy to locate for students on campus. So many students ask, how do I pay for the services I receive? The wonderful thing is that you do not pay any fee to see a medical provider in the clinic. So that means seeing either one of the physicians, nurse practitioners, or if you're coming in for a visit with one of our registered nurses, there is no fee for that. We do have a fee for other services. For instance, we do charge for laboratory tests, whether it's a point of care test we perform in the clinic, or if we're drawing blood to send out to LabCorp, which is our outpatient lab services provider, we do charge a fee for those services. The student does not pay any fees at the time of their visit. Those charges are sent to their bursar's office account, and the student just needs to pay that balance by the end of the semester. So we see the student regardless of their ability to pay at that time, and we offer our lab services at cost. There's no markup on the services that we offer for the labs that LabCorp charges us to process. We are not credentialed providers with medical insurance companies. So we do tell students that, yes, once you're seen at the Student Health Center, you'll be able to print out an itemized invoice of any charges that you did receive. And you are able, if you choose to, submit that to your medical insurance for reimbursement. We cannot guarantee that it will be reimbursed, but because of the services that we offer, we do find that students do find that to be an easy process for vaccinations we offer in the clinic or for any lab services as well. And we can definitely work with Kesha Trim's office, and she'll talk about that later on how that process works. As far as for receiving a prescription medication, so we are in the process of establishing an ability to dispense medications from the student health clinic. So for some of you who've ever visited an urgent care service, you may be familiar with being able to receive your prescription at the time of service. So we'll have a similar process as that. We're currently in process with the Virginia Board of Pharmacy to set up all the regulations, protocols, and procedures for that. And we're hoping to roll that out probably sometime later on in the fall semester. We don't have an exact date at this time because of all the legalities behind that. In the meantime, and as we've done traditionally, if a student needs a prescription medication, we will send that to any local pharmacy of choice for the student. So we always make sure that the student is aware of what pharmacy is in network with their medical insurance. And we have several pharmacies close to campus and several of them that are on the campus shuttle line as well, who are very familiar with working with our college students. As far as providing, services off campus, the campus does have a shuttle with varying hours that does visit some of the local pharmacy locations. Or if a student needs to have an x-ray done off campus, which we do not have x-ray services, there is a campus shuttle that goes to several locations as well. Next slide. So the clinic is only open from 8:30 to 4:30 during the academic year. We're closed in the summer for administrative needs, and we're also closed during all university breaks. So students and parents often ask, what do I do when the Student Health Center is closed? The great thing is that we do have an after-hours nurse service that is available 24/7 when the clinic is closed. So a student can call directly to the Student Health Center main number, so they don't have to memorize another number, leave a message for the after-hours nurse service, and a registered nurse will give them a call back and triage their symptoms. This does not replace an actual in-office visit. The nurses are not able to prescribe medications, nor are they able to schedule appointments, but they can definitely determine if the student needs a higher level of care. And at that point, the registered nurse can either loop in our on-campus campus security and safety, or recommend the student see an off-campus provider until the Student Health Center reopens. We do screen all of those encounters by the after-hours service, so we are kept abreast of what's going on with our students after hours from a medical standpoint. There are several urgent care centers close to campus. Again, several are on the campus shuttle that's accessible off campus. And again, if a student is being seen off campus, we highly recommend that they verify that the provider they're seeing is in network for their medical insurance as well. And we work closely with those providers for students who may need to see an emergency room physician or need to be seen at an urgent care facility as well to make sure that we have those records for continuity of care. We always remind students, and they'll hear this a lot as they join our campus community, if it is a true medical emergency, they're going to call URPD if they're on campus. If not, if they're off campus, they'll call 911. And they'll hear this plenty of times, so they'll have that number memorized and hopefully program in their phone as well. And finally, we do have, during the academic year, URPD does have a EMS group that is students that are certified EMTs that respond to campus emergencies on campus outside of the Student Health Center. So if a student does have a medical emergency, there are different support services available for students as well. So I know the big topic that many of you are thinking about as you're getting ready to gear up to join us in August is the pre-entrance health forms. This is a process that's required by the university for any new incoming degree-seeking student. We take our guidelines and policy from the Code of Virginia. Even though we are a private institution, we look to that Code of Virginia for guidelines on what we should require for our students, which is common for institutions of higher learning in Virginia and across the United States as well. So we have several forms that all newly admitted students who are eligible to come access our service must complete. And it includes a series of 5 required vaccinations, including tetanus, measles, mumps, rubella, polio, hepatitis B, and meningitis ACWY. Those are all 5 required vaccines. So what every student that's being admitted to university must do is they have to log into their student health portal, which I'll show you in the next upcoming screen, and complete these forms. This is one of 3 forms that must be completed for all newly admitted students. They also must complete a tuberculosis screening form. Tuberculosis is a highly contagious respiratory illness that many colleges and universities screen for students who are newly arriving to their campus. And third, there is a medical history form. This form is extremely helpful so that the Student Health Center is aware of pertinent family or personal medical history that may impact the care that we provide. So those 3 forms are available in the student's portal once you paid your deposit and have committed to coming to the university for a student to complete. And of course, their parent or guardian may have additional information to help support that. Those forms have a deadline for our incoming students for the fall. The form is due by July 15th. And for students who may be transferring in or starting with us in the spring semester, it's due by January 15th. So July 15th and January 15th. And this is important because the university does have a policy that if a student does not complete these requirements by the 3rd week of classes, and again, this will be reviewed in the fall, that a hold is placed on their account that bars them from registering for the next semester. And that again is adapted from the Code of Virginia, and all colleges and institutions of higher learning have similar policies such as that. Next slide. This is a paper copy of the immunization form. So we prefer, and it is required for students to fill out the form electronically. But if a student wants to see their primary care provider, let's say they have an upcoming appointment prior to coming to the college campus, or they need to get that information as far as immunizations they don't have available, you can take this paper copy, which is available on our website, the Student Health Center website, to your provider. They can fill this out. We do need the actual dates for the vaccinations, and then the student will need to use this information to complete an electronic form and also upload the provider's copy that's signed and dated so we know where the information came from as far as the dates. And this form is available on our website, but there's a process to also do in the portal as well. Next slide. So how do you get to our website? The easiest way is if you go to the main university webpage. Down at the bottom, there's a link for Student Health Center. So you want to click on that link, and then it'll take you to our webpage. There's tons of valuable information on our website, including frequently asked questions. It tells you a little bit about the providers and the nursing staff and our operations team as well. And then once you get to the red button at the bottom that says Student Health Portal, once the student clicks on that link, it'll take them to the login page for the portal. And our electronic health record is Medicat, which is commonly used for a lot of colleges and universities across the country. So the student will need to log into Medicat. It is recommended and it is required by the university that the student not share their login information because this login is similar to what they use for other applications at the university. So once the student logs in and they select the University of Richmond, next slide, they're able to access their portal. So as you can see here, this is where the student will complete those immunization forms. During the academic year when we're open, this is also where a student will schedule an appointment. That feature is not currently on because we do not offer appointments during the summer months, but come fall, once the campus reopens and the clinic reopens, you'll be able to schedule your appointment. The student will be able to see one of the providers in the health center. Next slide. So transitioning a little bit, a lot of students also come to college managing a chronic health condition, whether it be diabetes, a thyroid condition, anxiety, or depression. So a lot of students often have questions about how do I manage that while I'm away at college? We have several resources available. So for those prescription and medication needs, Student Health Center is a great starting point for that. If you are on high complex medications that a specialist is managing from home, we can definitely help get you connected with specialists in the community who will likely guide that care. Other resources available include disability services for students who may need medical accommodations, as well as the Counseling Center, which is our counterpart on the 3rd floor of the Wellbeing Center. So together we work with those departments and with our campus dietitians for students who may have healthcare needs associated with those departments. We do recommend for students who have chronic health conditions that you start thinking about a plan with your home provider now. We don't want you to wait until you arrive in August to figure out like, how am I going to get this expensive, hard to find medication filled? How often do I need to have lab work done? Those are conversations to have now. And many times a student or sometimes their parent or guardian will ensure that those records are uploaded through their portal so that we have access to them. And we are happy to share information on local specialists as well if you feel the need to connect with them before you get to campus, which many offices are familiar with that in the Richmond area. And as I mentioned earlier, we have a numerous number of healthcare providers in the area. So there are specialists available for anything you can think of in the area, and we're happy to make those connections for you. Another resource I wanted to briefly touch on, which you will hear a lot about as you arrive to campus in August, is Timely Care. So Timely Care is an investment by the university, along with other colleges and universities in the Commonwealth of Virginia, that provides additional counseling resources for students, along with health coaching, and also has some Talk Now features available for like peer-to-peer contact. It's a wonderful service that's free for students that are eligible for services in student health and the counseling center. When you get to campus in fall, we'll have a QR code for you. You can scan it and download the app, and we'll definitely talk more about those services as well. But Timely Care is available 24/7 for students once you've matriculated at the university. And again, as I mentioned before, a little bit about my campus partners. So I am part of the Health and Wellbeing Unit, and we are You Are Well. So we are collectively working to encourage and promote the students to have the best outcomes that they have from a medical, spiritual, counseling, mental health standpoint while they're here at the university. So whenever you see this logo across campus, just know that there's someone there who can help support the student no matter what their needs are. And I think we're going to save a little bit of time later for questions. But again, our email, if you do have questions, we recommend not sending specific health related information about yourself through email. But for general questions, you can email healthcenter@richmond.edu. You can also reference our website as well, which is healthcenter.richmond.edu. Or you can call us and the numbers listed there, and we'll have that available for you afterwards as well. Thank you.
Perfect. Thank you, Dr. Lemon. And now I'm going to turn it over to Kesha.
Thanks, Sage. So good evening, everyone. So I will spend a few moments here talking about our student health insurance plan, or more commonly known as the SHIP. So first and foremost, we have a health insurance requirement here at the university. So all degree-seeking traditional undergrad students, as well as law students, must have health insurance. And the reason for that is because we want our students to have access to off-campus healthcare in the case or the event of an emergency. And we don't want that to really upend their academic studies here, or have that worry about how to have access to affordable healthcare while in Richmond. For domestic students, they are under what's called a hard waiver program. So that means that you are required each year to either certify that you have health insurance, which is typically through a parent or guardian, which allows you to waive out of buying the SHIP or the student health insurance plan, or you can electively enroll in the SHIP. For international students are automatically enrolled in the SHIP by the Office of International Ed. There are limited exceptions where international students can opt out of the SHIP, and that is something that is evaluated by our insurance administrator. So open enrollment begins June 1st this year. I have a little squiggly in front of it because if I can get it open earlier or sooner, I will. But typically June 1st is the start of open enrollment. And that is the period where you can go online to either enroll in the SHIP or waive. And then it closes September 15th of this year. And so after that date, in order to enroll in the plan, you must have what's called a qualifying life event. So that means you have either lost health insurance from in another way, such as a parent has switched jobs or no longer has a job, and so you've lost your healthcare coverage, or some other event. Like commonly with our law students, they age out of their parents' plan and now they're able to they must get coverage elsewhere. So one of the important notes down here, if you see at the bottom of the screen, it says students who do not take action by the deadline will be enrolled in the plan automatically in late September. We ask that if you plan to enroll, well, one of the questions that we commonly get is, why should I go online and say that I'm going to enroll if you're going to automatically enroll me after September 15th? Well, the reason is because if we take a look at the next slide, here's the timeline. And you see that the open enrollment waiver period begins June 1st. And the policy starts August 1st. So if you wait until September, after September 15th, you have about a month and a half where your policy has begun and you don't have access to coverage. So if on August 8th, you decide you need to see a medical provider, you can't access your SHIP plan at that point because you have not officially been enrolled by the university. So that's why we ask people who intend to enroll in the SHIP to go ahead and enroll as early as possible, as soon as that enrollment period opens. A few more things from this timeline. You see that June 1st is when the open enrollment waiver period begins. And then for all the students who decide to waive out at the beginning, in July, the fall SHIP fee is added to the accounts who have not, to the student accounts of those who have not waived the plan. So it could be possible if you waive between June and July, you'll never see a fee on your student account. If you waive after July, you may see that health insurance fee on your account until you actually waive. And waivers are processed on a weekly basis. So if you waive on a Monday, wait until the following Monday to see if that charge is removed from your account. And don't worry if it still is there. If after that date it's still there, email someone and they will get that charge removed as well. Again, on this timeline, policy starts August 1st. The open enrollment period ends September 15th. And then the next thing that happens is in December, you'll see the second half of the installment for the SHIP plan. And then, of course, the policy ends July 31st. Now, one thing I want to point out, we have a number of students who do not waive before September 15th. And then sometime later after September 15th, even into the next semester, they'll come back and say, oh yeah, I forgot. I actually do have health insurance. Can I waive now? Well, our insurance carrier is at their discretion, but they will give you a refund, but you're only entitled to a partial refund based on the number of days you were insured. So if you decide to waive in November, you're going to get a refund, but only going back, or it's going to be less the amount of time that you were covered from August to November. So keep that in mind. And if you have other health insurance, don't waste your money buying this. Waive according to the deadline. Next slide. So, overview of our plan here. It's a United Healthcare plan. So United Healthcare has a vast network in this area as well as nationwide. It's a PPO plan, meaning that you do not have to have a referral to seek specialist care. You just make sure someone is in network and you make an appointment and see that provider. Also, this plan is not limited to Richmond. So as the majority of our students live out of state, if you travel back to your home states and you want to see a provider there, you can still access this coverage. The coverage period runs from August 1st of this year through July 31st of 2025. And so one of the things about this SHIP that's a little different than a parent's group health insurance is that you have to enroll in this plan every year. Your coverage does not automatically continue, even though you continue to be a student at the university. So you will go through the hard waiver or the enrollment process every academic year. For the 2024-25 academic year, the annual cost is $2,858. And the way we charge that is by semester. So you're charged that first amount of $1,429 for the fall semester, and then along with your tuition bill. And then the second installment is due in December for the spring 2025 semester. And that's the same rate for the student, any spouse, or children that are also covered under the plan. But for dependents, the student pays the university for their coverage. And if you have to enroll a dependent, you would pay the carrier directly after you're enrolled. Next slide. Of course, we cover all medical care and mental health care. And to note, like Dr. Lemon said, we have our student health center that is able to provide for many of your needs. We also have our CAPS center for counseling needs. But should you need to go off campus for specialist care or hospitalization, surgery, any of those things that we do not handle on campus, that's where this plan would come into play. And you also have telehealth benefits. So in addition to the lines, the emergency nurse lines that Dr. Lemon mentioned, you also have access to telehealth services through this student health plan. And if it covers prescription drugs and also travel assistance services if you are more than 100 miles away from campus or your home. Next slide. So this is the financial slide about the structure of the plan. And so you will see that the deductible of the plan, when you're using in-network providers, is always your best bet. So you have an annual deductible of just $250. If you're using out-of-network providers, you have a larger deductible that needs to be met at $600. After that deductible has been met, in network, the plan pays 90% and you are responsible for 10% of the allowed charge. And of course, again, out of network, you pay more. A couple of things to note. So for preventive care, so things such as your annual physical or a well woman exam or required CDC required immunizations, that is covered at 100%. In network, so no deductible applies. So you don't have to worry about if it's the beginning of the year and you want to get a physical, if making that deductible or having that deductible met. Also, for treatment at the Student Health Center, Dr. Lemon mentioned that there are certain things that the Student Health Center charges for, like lab tests or drawing blood, which goes off-site and is processed by LabCorp. So the plan pays for 100% of treatment that's processed through the health center, and no deductible applies to that either. So if you have those charges that are added to your student account, you can file a claim online, an electronic claim with the student health plan to health insurance plan to be reimbursed for that cost. The plan also has copay, so there are certain services that are not subject to the deductible, but you just pay a flat fee, such as an off-campus physician visit. So if you need to go off campus to see a dermatologist or some other specialist, it's just $25. If you need to go to an urgent care, it's $50. And of course, an emergency room visit is a little bit more at $150. Next slide. And we cover prescription drugs under this plan as well with the 3-tier system based on the formulary. So out-of-pocket maximum, the most you'll pay in any policy period as a single person insured under the plan is $6,350. And that's for in-network providers. So should you have a major medical concern, just know that your responsibility is capped at that amount. So it won't be beyond that. Next. While the SHIP covers the medical needs, it does not provide all the needs. So we have voluntary dental and vision plans that are available on our insurance provider's website. So these are just a couple of examples of what's available here in Virginia for either dental or vision. You will not pay these amounts to the university directly. You will sign up with those different providers to access that coverage. Next. Resources. So we have a couple of different websites that are available to you. So the first one is the university website. And so this is the site that's managed by, of course, the university, and it's studenthealthinsurance.richmond.edu. And I know that's a very long URL, so it's kind of hard to see, but also ship.richmond.edu will get you to the same place. And there you can see the insurance requirements by population. We also put the rates online, benefit information, and just some general FAQs. And we link to campus resources. So under the resources, you see a link to CAPS and to also to the Student Health Center and our insurance carrier, because they have helpful videos on common insurance terminology or how to sign up for your My Account through the insurance company as well. I will say the website is going to be updated with the new plan year information closer to June 1st. So look for that to come out closer to then. Next. The other site is rcmdstudentbenefits.com, and this is our insurance broker or administrator who helps us with purchasing the plan and really helps coordinate and evaluate exceptions for students and they deal with a bunch of coverage questions as well, and they manage the waiver site. So it's another site that you would be directed to, and the links are all on the SHIP website, where you can click on there and go to the RCM&D site to enroll or waive. You can also find a doctor, hospital, or lab that's in network and view prescription drug information. And again, enroll in that voluntary dental and vision. So just so you're familiar with that. Next. Lastly, here are our SHIP contacts. So again, I'm Kesha Trim, and I am the on-campus resource for you. So if you have questions about, does the hard waiver apply or eligibility, I'm supposed to have access to this coverage, but the system doesn't recognize me, I'm going to be the one that can answer those questions for you. Or even if a question isn't in my wheelhouse, I can coordinate getting the correct people into the conversation for you.
Sorry.
That's okay. Tim Cummins is our insurance administrator with RCM&D, and he is going to be able to answer all the waiver questions, provide exceptions for international students, enroll you if it's a qualifying life event after that open enrollment period. And he also can provide specific claim assistance. So a lot of times what will happen is a student may have a question about the amount they have to pay, or a claim that was denied by the insurance carrier. So a lot of times, for instance, if you go into the emergency room with a broken bone, the insurance carrier may put a hold on paying the claim because they want to see if someone else is at fault. Like, for instance, was there a car accident? And so now we can hold an automobile insurer responsible. So they ask you to provide additional documentation. Well, if you don't see that, they may deny the claim. And so Tim can look into those things for you to see what's going on, tell you what's needed so that your claim can be processed, and he can answer other questions. He will require you to give him access to your account or give him access to your records for privacy concerns and reasons, but he can provide that assistance. And lastly, United Healthcare. So United Healthcare is our insurer. So they have their 1-800 number, their customer service that you can reach out to. And they are going to be the best ones. Like if you have questions about your ongoing treatment or coverage for an upcoming procedure or a diagnosis that you've received, they are giving you general policy information. So those are the three main areas you would reach out to if you had any questions about managing your student health insurance plan. So that's about all I have. So we'll turn it back over to Sage to see if we have any questions.
Yeah, let me stop this share. And we do have a couple of questions here. So let me open that up. So the first question we have is a question about, is there someone to contact or some way to look into if someone has a religious exemption form for a vaccine?
Yeah, so we do have a process for that. There is a standard form for the Commonwealth of Virginia. There is information on our website, or you can call or email the Student Health Center and we can send you that form. The form must be notarized, and also of note, if the student is 18 years or older, the student has to actually sign that form and get it notarized versus the parent or guardian if they're under the age of 18.
Thank you. The next question we have is, as an international student, do the medical and vaccination forms have to be written in English?
Yes, the policy for the university is that documentation must be submitted in English.
Thank you. The next question we have is, do international students have to enroll in SHIP every year, or is it automatically provided?
Yes, you do, but international students are enrolled in the SHIP by the Office of International Ed, so they will take care of that for you. You'll just see the charge on your account.
Awesome. And then the other question we have here is there a waiver for low income students who can't pay for insurance?
No, there is not a waiver for low income students who can't pay for insurance, but you can reach out to the financial aid office to see what additional aid may be available to you to help pay for the insurance if you don't have other insurance. And then if you are a resident of Virginia and you're low income, you may qualify for Medicare and other programs. So
And then the other question is, can the health center be used if not on ship? Which,
So yes. So the health center, their operations are different from the student health insurance plan. And I know Dr. Lemon mentioned that they are not authorized or set up to take insurance, but we have a special arrangement with our student health insurance plan that allows students to file those claims for reimbursement for any charges incurred at the student health center.
great. Another question we got, I think this might have been in reference to the question before, but person is asking, what if a student is covered under Medicare in their state, and like how do I guess they work
Yes.
with that?
So if you're covered under Medicare, in the waiver form, there's a question about the type of coverage you have, and it specifically asks about Medicare. And then there is additional guidance on understanding your state's Medicare plan or reaching out to ask and ensure that that coverage is valid while you're here in Virginia, at least for emergency situations. So yes, most students who are under Medicare in their home states are still eligible to waive out of the SHIP, but you can also purchase it as well.
Great. And then the other question I have is, what or where do I find the form to waive the student health insurance plan?
So if you go to ship.richmond.edu, there will be links on pretty much every page that say click here to enroll or waive, and it'll take you to another website. So just bear with us with that, but it'll take you to another website, and you'll click on a link to enroll or waive, and I think it takes you to yet another website. So about 3 clicks to get there, and then that's where you enter your information. And so to begin the waiver process, it'll ask you to enter your university student ID number, and I think your date of birth and your name, and that'll open the form. And you have to have access to your University of Richmond email account because that it'll send a verification code because of security and two-step verification processes. And then from there, you can complete the waiver form or the enrollment form. It's pretty much the same process. Again, that'll open in June. So the links on the website currently don't work, but June 1st, they should work.
Okay. Well, I believe that's all the questions that we have. So I just want to say thank you to everyone for attending tonight, and thank you to our guests here for being here and presenting and answering questions. I will just say, if you think of any questions after the fact or after you go out of this webinar, obviously, again, people have given their contact information, but also if you email newspiders@richmond.edu, we can always work to connect you with people to answer any questions that you do have. So again, I just want to say thank you to everyone for being here tonight, and I hope that you have a wonderful evening.
Thank you.
Thank you.
Bye.